thank you all for joining us. And for our next conversation, I am really just delighted and honored to be joined by three experts who are working on two of the many, many crises that we are confronting right now as we try to truly move forward out of kind of the depths of the COVID-19 pandemic. The deep, painful vaccine inequity that exists across our world, and unfortunately, the deep and growing vaccine hesitancy that exists across so much of our world. We know that without urgently and robustly addressing both of those, hopefully to meet this moment and to build resilience for the next pandemic, we will not be able to move any of our lives forward in any kind of real, durable way, because if we have learned anything over the last couple of years, hopefully we have learned how deeply interconnected we all are, and that, as the saying goes, viruses don't need passports to cross borders. So just deeply grateful to the three people who will be joining us for this conversation, for their time today, and even more for all that they are doing kind of in their respective organizations to really help ameliorate vaccine hesitancy and better kind of facilitate enabling and empowering the world to vaccinate itself. So in this kind of wonder of Zoom, I hope that you all join me in welcoming Alex Diaz, the Senior Manager for AI for Social Good and Crisis Response at google.org. Maybe Alex, you can just give a wave. Yep. Hi, Alex. Hi, thank you so much for your time. Jessica Malati Rivera, Infectious Disease Epidemiologist and Senior Advisor at the Pandemic Prevention Institute. Maybe, Jessica, you can give a wave. Yep. Hi, thank you so much, Jessica. Chido Cleo Mpuba, Special Envoy on Youth at the African Union Commission. Maybe, Chido, if you could give a wave. Fantastic. Thank you all so much. I wonder, Jessica, if we can start with you. While your title is very much kind of the official, infectious disease epidemiologist, I know you are also very much a science communicator, and you've had a really active and robust presence, not only kind of on social media, but kind of in more conventional media, trying to use your expertise and your many, many, many years of training to not only kind of debunk misinformation, but really to highlight for those of us who may not be living kind of in these misinformation silos of the very real existential threat that misinformation presents to all of us, even if we are not on the receiving end of it. I wonder if you could share first kind of why you decided to kind of take on this new job of being like a science communicator, and what do you want people who are joining us today to know about kind of what you think is happening right now in vaccine misinformation and science kind of mis and disinformation more broadly.
Right. Thank you, Chelsea, for this wonderful event and for the kind introductions. I think that, having a specialty in infectious diseases means that you wear a few hats. You kind of have to understand the dynamics of how pathogens spread in human populations, but also how they're talked about in human populations. And unfortunately, misinformation, disinformation, or just too much information is not unique to COVID-19. We know that conspiracies and snake oil salespeople and all kinds of lies are in tandem. They outbreak in tandem with infectious disease outbreaks. You can trace that back to even the origin of smallpox and the smallpox vaccine, when people thought that if you took the vaccine, it would turn you into a cow. So those things are they have a long history of being connected to each other. And in a digital age, I think the speed at which that misinformation and disinformation and just too much information spreads is unprecedented. As much as I hate the overuse of that word, I really think it's appropriate when we talk about just the deluge of information and content that people can consume about COVID-19. And so throughout the pandemic, one of my main roles was the science communication lead at the COVID tracking project, where we were managing the data for all 56 states and jurisdictions.
Maybe you could just explain, sorry to interrupt, what the COVID tracking project is, for
Sure.
people who may be unfamiliar with it here in the United States, or for people, joining us from around the world.
Sure. The COVID tracking project was an offshoot from The Atlantic magazine, started by two journalists who were trying to get a handle of testing data in the absence of really standardized data from the federal government. It ended up being a very large volunteer effort of about 800 volunteers to essentially make sense of all the testing, case, hospitalization, and death data in 56 states and jurisdictions. And as the science communication lead, I worked very closely with our data team and our data visualization team and our editorial team to help translate that to the public. And I think a lot of times science communication can be oversimplified as just debunking misinformation, but one of the primary goals is to help elevate people's literacy in science and data. Because I think that we do a disservice when we make it seem hard and too complicated for folks. I think we want to invite people into the process and say, it's welcoming. It's actually understandable if we take some time to explain it. And there's a quote by Sir Mark Welpert that kind of motivates a lot of my work, which is that science isn't finished until it's communicated. And I feel very strongly about that if we leave science behind closed doors in universities and laboratories, we really, really keep people in the dark. And in a time where all of us are being asked to do our part to help end this pandemic, it's important for us to make sure that science is going out into the public in easily digestible, judgment-free ways.
I wonder, Alex, if we can just turn next to you, since we're kind of talking about communication, and clearly, Google is one of the largest platforms on Earth and in history. And I wonder if you can just talk a little bit, as a starting point, about kind of what you do as kind of the head of the crisis response and humanitarian aid kind of program at google.org. What do you want, people joining us today to know about what google.org is doing now, kind of what you're looking to do next? And I wonder also if you can just share how what you've done has changed over the course of the last couple of years.
Yeah, thank you, Chelsea. It's an honor to be here with some luminaries that I deeply admire and respect. So Google.org, for those that don't know, is Google's philanthropy, and our mission is to try and bring the best of Google, our resources, our funding, our technical expertise, probably more than anything, to help support and solve some really thorny problems. Of course, in the crisis space, COVID-19 being probably the largest crisis of our generation. So what we were focused on and how we approached the crisis definitely evolved over time. In the early days, it was about trying to provide as much cash support to entities that needed it around the world. A big chunk of support to WHO to provide critical services, whether that's actual medical supplies, and then working as the virus spread from country to country. Our particular focus is on lower middle income countries, making sure that any country that was facing a surge had additional support. But to the question on communications, I think there's a couple of different things that we tried with the COVID crisis. One is, of course, the .com side of the house, and the big microphone that our search and YouTube platforms can have. And particularly with search, one thing that our team worked closely with them on was providing just free ad space to do public service announcement campaigns. So the team, has released hundreds of millions of dollars in free ad space to orgs like Gavi and to orgs like the WHO and relevant government ministries to really supercharge and reach people where they are with the messages that they need from those, authoritative information sources. That said, not everyone sees those entities as the most authoritative. For a lot of local communities, it's their local doctor or it's their community-based organization, head that they go to. It's their church, their pastor. So where we came in from the .org side of the house was, how do we help address this trust crisis? How do we help arm the folks on the front lines of communities with the information that they need to address the many questions that are coming to them about the disease itself, about vaccines as they became available, because it's right for people to have questions. So let's make sure that the folks that they trust most have the resources that they need. So we funded organizations like Partners in Health. We funded organizations like the CDC Foundation that had a really broad, CBO approach, community-based organization approach, and to make sure that there are, communication touch points between public health, ministries and departments and the actual front lines of the communities. I think decades of underfunding in our public health infrastructure has led to a little bit of that fraying of those relationships. So how can we do, our part from the philanthropic side to try and build some of that connective tissue back again, but knowing that this needs to be a continuous dialogue, because we know this won't be the last, infectious disease that affects our communities. So yeah, just a quick overview of some of the stuff that we've done there.
Alex, I also just want to take a moment and give credit to the, as you said, other side of the house on google.com, because even before the pandemic, Google, YouTube, took away the ability of the large purveyors of anti-vaccine mis and disinformation, took away their ability to monetize off of that or to profit off of that. And that is not the standard that all of the tech companies, even in this time, have even had a posture toward, and many that have even had the rhetoric haven't actually had the actions to match it. So I certainly, it was important to us that, someone, hopefully from Google would be able to join this conversation, because even before the crisis, I think you have been trying to do kind of the right thing when it comes to vaccine mis and disinformation and ensuring there is good information, although recognizing, what kind of Jessica's admonition that sometimes you can even have too much of good information. And hopefully we can talk a little bit about that as well. Chito, I want to turn to you, as Alex was talking about kind of helping to facilitate communication to, hundreds of millions, billions of people around the world. You have, quite a significant position. I mean, you represent, hundreds of millions of young people across the African Union, across more than, 50 countries. And we know that there are truly, more than 700 million young people, on the continent. And so that's quite a large charge that you have. I wonder if you could, just as a starting point, share what you do kind of, as an envoy and kind of what you've been focused on and this COVID time as relates to both kind of vaccine hesitancy and also trying to help support the African Union's efforts and the African kind of CDC's efforts to really have more rapid and more equitable distribution of vaccines across the continent.
Thank you, Chelsea. First of all, it's such an honor to be here and, with the amazing panelists as well. And just to speak briefly in terms of my role, it's such a huge responsibility, like you said, representing the voices of young people within Africa and young Africans within the diaspora. So I work within the African Union with the chairperson to ensure that I represent these voices and the challenges that they're faced with across the continent. And also because within the African Union, it's made up of the 55 member states, the countries within Africa. So I ensure that I lobby for the young people with their member states at policy level, as well as working with partners within the private sector, within the public sector, to come up with initiatives that contribute positively when it comes to young people and the issues that they're faced with. And, it's a new role. I just, got appointed in November, but officially assumed duty this week, actually, at the African Union headquarters. So whilst it's a new role as well, previously, my predecessor set such a great foundation for the role. And it came about when the African Union was looking at their governance structure to make sure that they're represented, there's a representative of young people across the continent below the age of 35 within the cabinet, just to ensure that when we're looking at the future, their voices are represented. So it's a huge responsibility. And just in the beginning, at the initial phase, I'm actually in the process of, building a team, looking at the youth programming. But I thought it was very important that I start off with listening. So I've been taking time to intentionally listen to young people, listen even to partners, listen to governance, which will also help further shape the work plan within my office, which is a 2-year term, just aligned to the chairperson's term. So we actually in the middle of rolling out a digital survey that, just so that we can also get young people to contribute, mention the challenges they've been faced with, as well as what they think should be the solutions on the continent, but also not forgetting young people in the marginalized communities, because in Africa, not everyone has access, digital access. So I'm also going to ensure that with physical consultations, so that, we be able to reach everyone on the ground and that every single voice is represented across thematic areas that we're working on, but that'll be further shaped with the voice of young people, including on, COVID-19 and vaccination equity being a priority. And, I would admit that there have been so many challenges that young people have been faced with across the continent because of the pandemic. If we look at education, for example, before the pandemic, already there was a challenge, 37 million young people out of education. But now with the pandemic, that's an additional 32 million and, 40% that have been affected. And, this is because of not having money for school fees. Their parents are out of employment, some not even having access to technology. So when, during the pandemic, when everything moved to the digital space, they did not have the access to it, so there are just so many reasons, schools shutting down, because of this. Some children have lost their parents through the pandemic. And it's such a sad case, that a lot of young people are out of education because of this. If we look at unemployment as well, already we had a huge number of unemployment in Africa because young people are the largest population, but this has doubled. Before we had 10 to 12 million young people every year that are entering the job market, but out of those 10 to 12 million, there's only 3 million jobs that are available. And already because of the pandemic, this has been worsened. And if you look at now access of finance to young people in terms of entrepreneurship, there's still a challenge that is faced there. If we look at it from a public health perspective, as you mentioned as well, when it comes to vaccination equity, we have a lot of young people that have not been vaccinated as yet. Even from a mental health perspective, in Africa, mental health is still stigmatized. And, there are a lot of young people that have faced challenges with mental health during the pandemic, on top of neglected tropical diseases, which are already such a huge challenge in Africa. And you find that, a lot of young people at school were receiving deworming, facilities. And now when, COVID, when we're in the middle of a COVID pandemic, they've not been able to receive this. So again, it also affects, entities, and there's just, everything interconnected, but really, really affecting young people on the ground. And there's just so much work to be done, such a rich responsibility as well, within the portfolio and the constituency that I'm representing across Africa and even within the African Union.
Well, Chito, thank you for sharing your work and for what you're focused on. And, Jessica, as I was listening to Chito speak, I was struck again by how devastating COVID has been for young people over the last couple of years. And I think we still have kind of this just intrepid myth that somehow COVID hasn't affected young people. And I don't really know why that has had such staying power, despite huge amounts of evidence to the contrary, whether we're looking actually at the young people and children who have died of COVID, here in the United States or around the world, or the many children who have lost a parent or a grandparent or another loved one in their families, the huge disruptions in schooling, the rise of child marriage rates around the world. I mean, just kind of on any and every indicator, this kind of period has been hugely negatively impactful for kids. And we know that, as Chito was talking about, kind of the many millions of kids who will have missed kind of the routine health visits that are often facilitated in schools, or the routine health interventions that are facilitated by schools. We know here in the United States, millions of children are behind on their routine immunizations. And we know too, unfortunately, that all of the mis and disinformation around COVID-19 vaccines has had a knock-on effect on other vaccines, as now parents and even adolescents are saying, I don't want to get an HPV vaccine. I don't want to get kind of my child their last MMR shot, and. I wonder, though, even with that kind of depressing segue, what you have found to be productive in helping to kind of break through the miasma of mis and disinformation around kind of vaccines broadly to really help parents, adolescents, even kids themselves understand, why these public health measures are so important, not only at a population level, but also for their own health, for their family's health, for their community's health. Kind of what has worked, and what do you want any of us kind of in this conversation to know about how we can be better science communicators, even if clearly not quite of your caliber?
I mean, this is such an important point, and I think it actually stems from a misunderstanding of risk versus hazard. I think humans in general are just really bad at measuring risk. And I think it's really easy for people to look at some metrics that are maybe epidemiological metrics, like outcomes of a disease, and look at that very, very myopically. And I think the problem is when people look at, say, deaths overall, and you compare deaths overall for COVID-19 among a certain cohort of pediatric population, and you compare it to something more pathogenic or more virulent or something more dangerous, say polio or even influenza, it's very easy to have this kind of assessment, a flawed assessment at that, of what's more severe. I have parents in my DMs constantly saying, well, if your kid is much more likely to die in a car wreck than they are of COVID. And I'm like, again, apples and steaks, really. We're not.
Also, Jessica, they're probably putting seatbelts on their children.
Touche. I've said the same thing. And so I think that the problem is it's complicated, but I think the solution is relatively simple in that we have to help elevate people's understanding of what risk is, what hazard is, and also measuring things like multiple outcomes that are devastating. The list that you mentioned is long and it's not even complete. I mean, there was a huge study that just came out on the impact of orphanhood and the cycles of poverty that this has now thrown women and children in because of people losing caregivers, because of people losing parents and family members who are the people who educate and feed and shelter those children. And I think we're doing a huge disservice when we oversimplify outcomes of an infectious disease by just numbers of deaths, when we also know that from the data perspective, every death total that we've seen from almost any jurisdiction is most certainly an undercount. We are just scratching at the surface of the impact of this disease and the cascading consequences that it's going to have. And that's why I think that when we talk about data, there has to be an emotional intelligence in this too. It's not just numbers. I very much speak from a position of a mother. I have 2 young children and a third on the way. And I speak with that as my bias, that I have been trying to protect my children and protect their communities, because I know that they don't exist in a world of just a bunch of minors, right? They are friends with people who have, friends who live in multi-generational homes, people who are in their households that have pre-existing conditions. And so because of that, teaching my kids and teaching my audience from the beginning that every single person is connected to a school, for instance. Even if you don't have a student in your house, there is somebody who is connected to an administrator, a teacher, a cleaner, a person who knows somebody or a neighbor who goes to school, that we are so connected that our individual choices have very, very big ripple effects on the communities that include children. I think helps elevate people's emotional understanding of these numbers, because when you're just looking at raw data, it's so easy to fall into these fallacies of it's not that bad.
Yeah, I think that is so painfully kind of well said and well framed. I wonder, Alex, with what feels like limitless resources, not only financial resources, but kind of intellectual resources and data resources, at google.org. What are you focused on now, kind of as relates to the ongoing COVID-19 pandemic, especially kind of anything in this conversation around kind of data and kind of information with real kind of integrity? And how do you decide at google.org what to focus on? Because, as Jessica and I were just kind of building off of kind of what Cheeto was saying, there are so many kind of attendant crises that were exacerbated by COVID-19, catalyzed by COVID-19. There is almost a limitless amount of need for your limitless resources. So kind of what are you working on now with kind of any nod or not to mis and disinformation? And how do you decide kind of what to work on next?
Yeah, it's a great question, Chelsea. Let me start with a data piece, and I'll tell you about some stuff that I'm thinking about in the broader humanitarian space. On data, I think one clear thing that we learned through this pandemic is that consistent, granular, and organized data is critical for a public health response. And to that end, I mean, we have a bunch of data experts at Google. So one thing that we were focused on is like, how can we bring some of that expertise to bear to help with the problem? And one thing that the Google.org team has, we have a program called the Google.org Fellowship, where we can actually send full teams of product managers, engineers, UXers, et cetera, on full-time secondment to nonprofits to just build whatever product or data system.
Alex, sorry, explain what UXers are, maybe for people who
Sorry,
might not.
Yeah, a UXer is a user experience researcher, which is just like a person that has the skill set to do really deep human-centered research that can help inform a direction of a product, and that makes sure that whatever product gets built is like actually usable and user-friendly, depending on the audience that you're trying to hit. So I'll give two quick examples on like data related projects that some Google.org fellows worked on that we augmented with grants. And one's actually related now to where Jessica's sitting, because an entity that we supported is now at the Pandemic Preparedness Institute. So one is a project called Global.Health. And it was a coalition of researchers from Boston Children's and Oxford and Northeastern and Johns Hopkins, all some really smart infectious disease experts, computational epidemiologists, all coming together to try and build the largest global repository of individual anonymized data about COVID cases. And they've since now shifted over to be working on variants of concerns, among other things. And this type of data at the case level is really important and critical to understand not just where COVID is today, but where is it likely to spread next? And then how can you help in terms of like the work that Jessica does, especially on the communications, how can you help the public health decision makers understand that, internalize that, and then make the right decisions to help, bend the curve or help make sure that we're not seeing the surges in hospitalizations that we have with some lead time. Another project that I'll just shine a quick light on was led by the Morehouse School of Medicine, a group led by Daniel Dawes, who I admire deeply. And what the problem statement that they were trying to address was, we had early anecdotal evidence, at least within the United States, and I'm sure true abroad, that certain communities are being hit hardest. But there wasn't a consistent data stream that can be used to help power some of these arguments. You had, evidence from a city or a county here, but there wasn't that countrywide view. So what we sent some engineers and product folks to do alongside them was build a health equity trackers. If you go to healthequitytracker.org, that now exists. And importantly, what that tracker does is it combines social and political determinants of health. So it says, not only where COVID incidence is high, but how does that correlate with relative poverty? How does that correlate with uninsurance rate? How does that correlate with all these other, non-health determinants that do affect people's health outcomes in the systems that we live in? But it also has shown a light on, and that's important to understand, like, where are these intersections and how can we start to address these intersections to make sure that we are putting forth policies that have more equitable health outcomes. But it also shown a light on where does data not exist? Because on the map, it will show like, hey, we just don't have data here. And that can serve as a carrot or a stick, depending on how you receive it, for states to then say, hey, maybe we should start trying to either collect the data if we currently aren't and label it appropriately, or if we do have it, open it up so that researchers and policymakers and advocates can have access to that to inform future direction. Now, in terms of things that I'm working on moving forward, it's a little bit broader in terms of not just on COVID, is traditionally I'd say like systems of humanitarian response to crises, natural disasters, and otherwise have been reactive. So they'll watch conditions deteriorate, and then only when public and political media coverage reach a pitch is like funding and assistance mobilized to relief organizations. And this reactive approach, of course, saves many lives, but it's slower and less humane than it needs to be, especially when it comes to climate change. Not to completely change topic, but like the accelerating climate crisis and all the intersecting conflicts that it triggers, including hostilities over like scarce resources of water and land, clarifies how urgent it is to like start to anticipate these risks and build these like predictive systems that can at least give us that early warning that we should start releasing aid earlier. So say we know with some lead time that a flood is coming and it's going to hit a particular area, why don't we start mobilizing the resources in advance and see if that has an impact on mitigating loss of lives and livelihoods instead of waiting for after the fact. Now, you can't reach everybody and you will need to still support folks after the fact, but hopefully you can brunt the damage a bit by helping have some of these anticipatory systems in place. So we've been working with organizations like UN OCHA's, the Office for Coordination of Humanitarian Affairs. They have a team at the Center for Humanitarian Data that serves as like the data analysis backbone for the UN system, and just trying to provide them the resources that they need to fill capacity gaps, data gaps, and trust gaps in these anticipatory systems. Because I do think the humanitarian system as a whole needs to move from a larger reactive model to a much more proactive model with intersecting and growing crises moving forward.
Thank you. And Alex, I just want to say the work on kind of not only data integrity, but kind of data collection and standardization is so important, partly because when states stop reporting data, we then know, because which has happened here in the United States recently, including in some places I wasn't expecting. But the temptation, I guess, to just will the end of the virus as if we can do that by no longer looking for it is, I think, either the height of arrogance or kind of just painfully reflective of how little we've learned, and probably it's some combination of the two. I know we are kind of at time, but I do want to give Chito the last words, if you will, to just kind of share anything that you think you would want kind of our students or our community to know about kind of what the African Union is doing or what you hope to be doing kind of on vaccine disinformation. And we spent so much time talking about that. We didn't really get to vaccine equity, which just says to me, we have to have another conversation soon, kind of focused on that equally urgent and kind of equally kind of morally clarifying crisis about kind of where we are not as a world. And hopefully that will help spur us to where we need to be. So Chito, what can you kind of share from the EU perspective or even your perspective on kind of vaccine disinformation or anything that relates to kind of vaccination broadly that you would want our community to be aware of? And then also, if people want to get engaged in your work, kind of what suggestions would you have for people who may want to reach out to you, or students from the African Union or the diaspora or beyond?
Thank you, Chelsea. I think first of all, I'll start off by saying that I believe that everyone has a contribution to make. When you talk about vaccine misinformation, we all can play that role in terms of making sure that the right information reaches young people, reaches our peers, and also reaches families. It starts with each and every one of us. I'll also share a personal story myself. I'll be really honest. At the beginning, I was also very reluctant in terms of getting vaccinated because of the misinformation. It took me a very long time because there was lots of misinformation going around. As a young person myself, I remember there was so much misinformation in terms of, okay, if you get vaccinated, would you be able to have children later on in life? And I thought that would affect me personally. And it took a very long time for me to actually make the decision to get vaccinated. And that decision came from listening to my peers that had been vaccinated, listening to family members that had been vaccinated, that were speaking positive about getting vaccinated. But we still have a large number of young people that have been misinformed. And I realized that it starts small, as within your peer circle, making sure that we change that narrative because it's not true. And with the African Union, recently, we launched an initiative called the Bengal Initiative, which was actually yesterday with the Africa CDC. And this is targeted at young people just to become champions and speak, try and influence their peers to get vaccinated. So they're champions within their communities, champions within, be it in a family, champions being it in university. But we've opened that up for young people to get involved in this, initiative, to ensure that we reach young people and ensure that the right information reaches young people. And we provide a toolkit that these young people can use within their communities in order to influence more people to get vaccinated. So I think it's an important role that we all play beyond where you are based at the moment, but there's a role that you can play, even just leveraging on technology and social media, speaking positive, and also setting that example. If you've received the vaccine or the vaccine boost as well, sharing your story, sharing your journey, ensuring that it's on social media, it might influence, the next person. And now with regards to the Office of the Youth Envoy, at the moment, I'm very open. I usually say we're very open. And the reason I say that is because I'm so conscious about the constituency that I represent. And I believe that this is not a one-person role. I have to do it with the young people. So each and every time I say we, because I'm talking about the young people that are going to get involved, with regards to the Office of the Youth Envoy. So at the moment, we're actually open for, young people that would like to be seconded within the Office of the Youth Envoy, young people that would like to also volunteer within the Office of the Youth Envoy or contribute, especially at the initial phase. As I mentioned, that we're literally at the early stages of everything. And at the moment, I'm actually working with volunteers. And these volunteers are people that approach me from social media as well to say, you know what, you have this office, would like to offer our services. We really like to, hold hands and ensure that we build an Africa that we want, according to Agenda 2063, which is, what we're aiming for the African Union. When you look at Aspiration 6, for example, within this Agenda 2063, which is similar to the, United Nations SDG goals, Aspiration 6 talks about an Africa whose potential relies on its people, especially young people. So looking at that and that aspiration, really, it's an open door policy, especially within the Youth Envoy office, where I've really taken that time to listen to young people. It doesn't even have to be within the formal channels or having to go through a number of people, but I'm open on social media. I take time to interact with young people and those that have actually said, what, I have a strength in this and I really love to come in and help. I've taken them on, come up with, interim steering committees as we're literally trying to build everything, at the beginning. And I'm also being conscious that I still have so much that I can also learn from young people. So I've also been open to criticism. As I mentioned, I'm the second person getting into this role. It's fairly a new role within the African Union, and there was a bit of time, a number of months until they appointed the second youth envoy following my predecessor. We set a great foundation for this role. So I've also been open to that criticism that comes from young people, because young people are very vocal. So some will come and they'll say, what, I think you should do this differently. We don't like the way this is happening. So I've also been open to that. And I'm really open to it now, even when I'm, we're speaking to the students, I'm open to that. If there's something that you feel, what, I think this can be done better, I'm open to listen to that, because this is, for all of us young people, and it's for the future generation. It's not about me, it's about us.
Well, and Chito, my mother has always reminded me how important it is to take serious criticism from serious people seriously. The people who want us to be better at our jobs, better at our purpose in life, kind of better as friends, as partners, as parents. It's also, though, important to take unserious criticism from unserious people unseriously, the people who just want to tear us down, who want to prevent us from thriving and succeeding as our full selves. So I certainly hope that the young people, particularly, from the 55 countries in the African Union or from the African diaspora and also beyond, will reach out to you and engage with you productively. That will only be good for all of us. And I certainly want to thank Chito and Alex and Jessica, and will be presumptuous to say, I'm sure that if there are young people who want to learn more about google.org or learn more about pandemic preparedness or kind of what good science communication is and what it isn't, to please follow up with Alex and Jessica as well. Just thank you all so much for your time today. Thank you for all you're doing. And I hope we can have another conversation on vaccine inequity next time. Thank you all so much.
Thank you, Chelsea.